Barbara, I'm sorry.
Oh,
Barbara.
it goes back to Barbara?
I'm just too eager.
Thank you.
Barbara Willie. I was there at the groundbreaking for the Brenda Boss building, groundbreaking, and yes, indeed, it's going to be lovely, and it is going to house the rural health, and it's going to house the family health. Buildings will be moved over there, all of the personnel, and it is desperately needed. It's going to be like a state-of-the-art. It's in the name Brenda Boss is for Brenda Boss, who, because of she, back in the 70s, 60s, 70s, and 80s, is why the hospital is here. And her son, Dr. Boss, is a doctor at the hospital, which is indeed a great testament. You spoke at that. There was a hiccup or two. They have been straightened out. There is a new contract manager on site, on the job. There's been some changes made, and I see no problem. The planning committee was time on it. They've been on every single step of the way. They've been involved in it, and it is definitely an asset and a needed access for this valley and for the hospital. And it is, without a doubt, on target financially and on target building-wise. Their permits, everything. It's a go.
Sarah, we'll start with you this time. The healthcare district has had many CEOs come and go over recent years. As a board member, what process will you use to increase the likelihood of securing a top-quality administrator that would stay with the district?
Well, first Sarah Russ. First, I'd like to say that this turnover rate is just unacceptable. And I believe it's a symptom of the tumultuous relationship that's existed between the board of directors and the staff. I don't know if you know this, but we've actually lost 3 CEOs, 6 HR directors, and 6 CFOs in the last 8 years. This is a huge problem, and it is costing the district in time, money, and resources. One example of this is for the last 3 years, the hospital's been trying to get certified as a critical access facility. This certification would bring an additional $400,000 to the district annually. Now, all of us can do the math. That's $1.2 million in lost revenue in the last 3 years. Something needs to happen immediately. They need to conduct a thorough CEO recruitment process, and I think part of that, we need to have someone that has rural healthcare district experience, as well as experience working for a public or elected board of directors. And we need to hire someone that can provide strong leadership and stability to the hospital's management team. We must elect a professional and experienced board that can successfully lead the hospital through this hiring process, and in my opinion, it needs to happen now. Thank you.
Thank you. Joseph Kelly. When the board hires the CFO, or the CEO rather, that's going to take someone to look in that person's eye again and find out the truth. Is this a stepping stone for their career? Are they going to become part of the Big Bear community? Do they have any experience in a snow conditions that we live in? This is, as Sarah said, is a rural community also. These are things to look at. There are millions of people out of work right now. Bless you. There are millions of people in this country out of work right now. Some of them are administrators that we should look at, whether it's experience. Maybe it's a person that is in a subordinate position and ready to move up into a CEO, hospital CEO. Hopefully it's a person in California that can deal with California laws and regulations and our methods of auditing. And again, a rural, someone who can live in a rural and will become part of our community here, not just a stepping stone. We don't want to become a training ground and a place to just hang out for a year while they're looking for a different job. We need someone that's dedicated, and it's the board that has to interview that person and get the truth from them.
Ron Ern's 2-year term. This is the board's responsibility, and this is why You want to put the right people on the board. Right now, there are only 2 of the 5 current members who are actually elected by the voters. The other 3 were appointed by the existing board. So there's been a lot of turnover with the board of directors. So if the board of directors can't show the leadership, how can we keep the hospital functioning with the people that we'd like to have stay there without the board taking care of the issues for them? So I think it starts with the board, and I certainly would like an opportunity to play a role in that.
This is Janet Maxwell. Yeah, I think it is our most important part as on the board is to pick our executives properly and then to become united from the board to the executives to the nurses and the bottom feeders and back to the community. That's where we have to become united in this. And what Sarah said.
There you go.
Let's see. You started
Barbara gets,
to Barbara and then.
Barbara or me?
Barbara Willie again. We are right now, we have the board, the existing board has tasked the CEO to research executive recruiting firms. We are still in the discovery stages, and a final firm has not yet been selected. Some of the criteria that we have set forth is to try to attempt to get a CEO who does have rural health care background. This is not necessarily that easy. Our hospital has 9-bed acutes, and it has 21-bed skilled, and it has a 6-bed ER. It's not a large hospital, it's a rural hospital. And it's going to be a unique search in trying to attempt to get a CEO who is comfortable in that setting. And that's our task, which we're fully aware of and fully committed to do. As for turnover, I have a different opinion than Sarah. Having come from corporate, I myself reported to 3 chair people in 1 year. And I also have had experience in the past where I reported to 3 CFOs in less than 2 years. It is a consistency that is in many, many industries, and the healthcare district, healthcare system is one of them. And so we are not unique in having to find another CEO. What we are hoping is to find the right CEO and one that will fit into this rural community, mountain community.
Otto Lacayo. The Board of Trustees only has 1 employee, the CEO. And the CEO is under contract. In fact, the governor just signed a bill that says that the rural hospitals in California, which are about 56, must have a contract with the CEO. The CEO simply is an instrument that puts and guards the CEO's rights and also guards the board members' rights. And it's not unusual that CEOs, read Wall Street and you'll see them popping off left and right. Somehow or other, if a CEO is in a public company and stockholders are bad, they're gone. Doesn't mean that it's a bad CEO, it just isn't working. At the hospital, yes, there have been a number of CEOs that have left. And since I was appointed in late 2011, we faced that problem. And the interesting thing that the public has to understand that elected officials have 2 forums for meeting, a public forum and an executive forum.